Now, Lalita Kumaramangalam, this is not a new, like malnutrition, stunting, these are all chronic problems. They've been with us for a long time. But the fact is that shouldn't there be, especially now, given the fact that we've come out of or we're still in a pandemic, we should actually be increasing funding to these schemes. But actually, as we look at the numbers, they're very small, just 9,000 crores for this Poshan scheme for 3 years, 3,000 crores a year to fix malnutrition.
Yeah, I find myself in agreement with all of you today, and let me emphasize, I'm not here as either the director of the India Foundation, though I am that, or a member of the BJP. I have worked with women for 35 years, and women means you work with children too. As you've said, these are old problems. They have been around for far too long. The budget, both at state and central levels, must be increased for health. I find there's very little coordination between ministries that deal with this. You have ICDS in one place, you have noon meal scheme in another place. There's no coordination between the agencies, whether it's at center or at state level. And this really doesn't have much to do, as you pointed out right in the beginning, with whether you're industrialized, urbanized or not. The fact is that women are very rarely involved in these programs.
Right.
Mothers are the people who deal with their children's nutrition. Illiterate and poorly literate women who don't have access to, who have neither agency nor autonomy, especially when it comes to spending for their home and food. And again, as been mentioned for the girl child, they don't know what nutrition means. They really don't know what it means.
Okay.
In sanitary conditions, obviously, again, mothers are often the people who, deal with it.
Yes.
We need much bigger, I wouldn't just say private-public partnership. I think we need to have the beneficiaries of the scheme to become partners.
Okay, but at the
we need far more investment. One moment.
But at the starting point, certainly more public investment.
We also need to have more money put into the Anganwadis.
Okay.
Because most poor women work.
Okay.
And their children don't get fed well enough, partly because they don't have the time or the energy to give to that.
Okay. Let me get Dr. Prasanta Tripathi, as he said, community health specialist from Jharkhand. Sir, now Jharkhand, of course, the numbers are not out yet because that's possibly part of the second set of data that will come out of the family health survey. But you're on the ground in Jharkhand. Are you also seeing a stagnation or a worsening? And again, if that is indeed the case, sir, what are the reasons for it?
See, we have data for so many states, and we have seen that either things have been reversed or stagnated. Mention was made about stunting. I'm also worried about the percentage of children who are severely wasted, which is weight for length.
What's happening in Jharkhand, sir?
Yeah, I am just coming to that. This is in many places, especially in the underserved areas of Jharkhand, it is intergenerational poverty and impoverization that continues. So children are born with low birth weight. At least 40% children in some of the districts are low birth weight babies.
Right.
And then, if there is no maternity benefit, and especially for those who are not in organized sector, there is no protection. So they have to leave behind their kids. And also, there is supply side issues as far as women or families trying to keep their family size small and
those are chronic. Those are again.
Those are chronic.
These are But I'm trying to understand.
If you want to know,
you feel, if I may ask, do you feel that, or have you experienced that there's been any kind of scaling back of support, budgetary financial support to these schemes?
I can talk about two states, Jharkhand and Odisha, neighboring states.
Yes.
In the neighboring state where we have pro-poor policies, we see in certain regions like western and southern region of Odisha, I think the services, there is a lot of scope for improvement of services, and probably there has to be community participation and grievance mechanism. And as far as Jharkhand is concerned,
yes,
in the ICDS centers, there is a scheme for take-home ration, but it's not being supplied regularly after the lockdown. Whereas in Odisha, they have been able to manage that.
Right.
So,
that's an important.
At least some khichdi program.
Yeah.
Can be started immediately. I think kids can be fed khichdi's outside their creches in winter months in the Anganwadis.
Yeah.
In the winter months, people like to eat sitting outside. So social distancing
So
can
that
be
is
maintained.
that is an important
nutritious meals can be provided to them.
Right.